So currently I'm on my way to get my bloods taken. So every week during chemotherapy, they want to take bloods a day or two before I'm actually due chemotherapy. So this is just to make sure that my white cell counts aren't too low or I've not got an infection, because if I do have anything like that, then that will need to be treated first before anything else. Otherwise, there's no point going through chemotherapy. Otherwise, it's going to cause a lot of problems to myself. So yes, I'm on my way. We'll see how things go. Okay, so I'm sat here in the hospital waiting to get my bloods taken. I start chemotherapy tomorrow. Scary times. So I've had my bloods taken earlier today, and tomorrow I'll be starting chemo. But for now, this is the last shift that I'm ever doing until my chemo is done. It feels a bit sad that this is how I have to finish work and not like how work normally finishes. However, at the same time, I need this time off because it's the only time that I'll be able to get treatment and actually get treated for what I'm being treated for. My work team throughout the whole journey, they've been really supportive. So when it's come to things like getting time off for appointments, investigations, etc., they've always been understanding. So I really appreciate that from the work team. And overall, I do feel sad because it's my last day at work and tomorrow my life changes forever. I don't know if it will be for the better, for the worse. I don't know what side effects I'm going to have to go through. I don't know whether my treatment will be successful. I don't know whether I'm going to be getting any complications or not. So only time will tell, and hopefully you'll be able to see the whole thing, and hopefully it's all positive. So let's see how things go tomorrow then. Okay, so it's the day of my chemo today, and not gonna lie, it's a bit of mixed feelings, because on one side I'm very happy that something is being done. I'm starting treatment and hopefully we'll get on top of this cancer, but at the same time it's the feeling of now I'm no longer at work, my life's going to be on pause, I'm unable to do some of the same stuff that I've been doing before all of this happened. And yeah, it's just a change that's going to happen. And there's also the side effects that comes with the chemo itself as well. There's things like the nausea, vomiting, sore mouth, loss of appetite, the increased risk of infection. So there's going to be a lot that's going on, and I don't know how I'm specifically going to be affected by this, and it's just a wait and see type thing. So today's the first day, we'll see how it goes, and I'll document whatever I can from today, and I'll tell you what I think about it. So yeah, I'm on my way to the hospital right now. So here I am, parked up. Now I'm actually walking in the hospital towards the actual chemo suite. So first, the hematologist, the doctor, he wants to see me just to speak to me because it's the first time I'm having a chemo, and then he'll send me off to actually have the chemo itself. Okay, spoken to my consultant. He showed us the PET CT scan, just told us how the day's going to work, what's going to happen and things. So I'm going into the chemo suite now, and this is where I'll be having my chemo. Right, so I'm here in the chemo suite, and yeah, it's just these big sofas. Everyone's sat here, and yeah, I've got a cannula connected over here, and they've connected the medication to it. Yeah, it's my chemo is starting now. Let's see how this goes. A bit nervous, but I'm glad it's starting now. Right, chemo day 1 complete. At the moment, I feel fine. I don't feel very abnormal or anything. I've been given a lot of medication, which I'm going to be taking home. I will show you all of that. And yeah, so far, so good. So far, I feel fine. Let's see how this goes. I'll probably be completely different tomorrow. Day 1 of chemo is done. And to be honest, at the moment, I do feel pretty much normal. I did feel a bit of nausea when I was having some water. But more or less at the moment, I'm still normal. I'm assuming tomorrow I'm not going to be saying the exact same things because the side effects will probably start kicking in. But yeah, for now, I'm happy. Day 1 done. Don't know how many days left, but we'll get there in the end soon. I'm on my way to day 2 of my chemo. So day 1, so far it's been so good. The main side effect I've been getting is a lot of nausea. I've not actually vomited at all, but it's just the feeling of nausea. However, I've been given some anti-sickness medication, ondansetron and metoclopramide, and these have been working well, to be fair. I'm only assuming that this nausea vomiting will probably get worse, but so far it's been manageable. So yeah, day 2 of my chemo is expected to be about 3 hours at least. So the medication that they're giving today is the etoposide and the carbazine. And every morning whilst doing chemo, I have to take 70 milligrams of prednisolone, which is a steroid. And these generally, they come with a lot of side effects. And one of the side effects that I'm worried about is the muscle wasting with such high doses and prolonged courses. So what I'm trying to do in order to counter this is just do a little bit of exercise as I can whilst I've got the energy during the day. So for example, I'm aiming to do about 10 push-ups every morning just to try and counter it, and we'll see how that goes. So yeah, I'm on my way. So far, things have been good, and I'll let you know how things go. So it's day 2 of BEACOPDac, and I'm on my infusion over here. So yeah, I'm glad it started. Just one thing that I reflected on since yesterday, I had a decent sleep. All of my fevers have stopped completely, and my night sweats has gone completely as well. I'm not getting any sweats, so that's a good thing. So it's really good to see that instant effect. And now if I look outside, I got a nice view. I know it's nighttime or sunset over here, so it's hard to see outside. But yeah, the other thing I've been struggling with is more of my appetite. My appetite's not being that great. I'm not sure if that's because I just feel nauseous or whether I just can't be bothered eating. But I've been eating small snacks here and there. I've been trying to stay as hydrated as I can. I've been trying to stay as moving as I can as well. But other than that, there's nothing else that's been happening. So yeah, I'm just glad that things are going. My infusion is going to finish soon. And yeah, once this is done, then I'm going to go home and then I'm going to come back tomorrow for day 3. I'll let you know how that goes. Okay, so we're on day 3 of the BEACOPDac, and I think some of the side effects from the chemo is starting to kick in. So my last night wasn't that good. I just felt more awake. This is probably the high dose steroids that I'm taking. Yeah, it's just been hard to stay asleep. Like, I've just wanted to stay awake really. And now I'm just starting to feel more worn out. My stomach starts to feel a bit more heavy. I don't think it's acid or anything like that. It just genuinely feels more heavy. I've got more of a loss of appetite. But on the bright side, my hair is still intact, and you know, everything else still intact. But yeah, that's how I feel day 3. I'm currently on the way to the hospital to have day 3 of my treatment, which is again same as yesterday, dacarbazine and etoposide. After today, I don't need to go to hospital for another few days. Everything will be managed from home. So the steroid and the GCSF injections, which will help stimulate some of the white cells in my body, so I'm not too immunocompromised. But yeah, let's see how that goes, and we'll keep you up to date. Okay guys, so we're currently on day 5 of treatment, and I'm gonna group day 4 and 5 together because they've been quite similar. So the main difference between day 4 and day 5 is that everything is done from home. So I didn't need to come to hospital for extra chemo or anything like that, which I am so glad, because coming into hospital 3 days in a row and having chemo for 3 hours in a row, it was just wearing me out, and it just made me very, very tired. And just thinking about going to hospital as well, it wasn't having any positives on me. So having these days off from hospital, it's a really good blessing of mine. I still have to have the steroids every morning, and that's standard. All the normal medication I have to take every morning, that's standard as well. The only other extra thing that I have to do right now is take something called GCSF injections. And essentially what it actually stands for is growth colony stimulating factor. And the way that it works is you get injected with these factors and they stimulate your bone marrow to produce more white cells. Why do I have to take this? Because this treatment, the BEACOPDac, is going to make me quite immunosuppressed. My white cell counts are going to be completely down in the boots. So that's the reason why these injections are there, to help me produce my own white cells, so it reduces the risk of me going into something like neutropenic sepsis. So I've been having that yesterday and I've been having that today. It's fairly straightforward to inject. You just pinch a bit of skin in the stomach and you inject it in. So for me, my wife was doing it and there's been no issues so far. As you can see outside, the weather is quite decent here as well. So I have been going out for a walk with my wife and my kids. So that's been enjoyable too. And it just feels as though yesterday and today have been much better days. I've not had any antiemetics or any sickness tablets for the last day or two, and that's because I'm not really getting too much nausea. There's this small background amount, but I don't think even having tablets really improves that. And so I'm just happy with the level it's at. My appetite, I'm managing to eat food. I think steroids are helping with the appetite. I get full very quickly, so my portion sizes aren't too big. And the only other major thing that I've noticed over the last few days is that I have this weird taste in my mouth all the time. I wouldn't describe it as a metallic taste or anything like that. It's very hard to describe the taste. It's kind of like when you have some sort of juice or sweet drink and you have that lingering taste at the end of it. It just feels as though I have that taste all the time. So even when I'm drinking something like water, it doesn't taste like water to me. And that kind of puts me off drinking more water, but I know that it's really important for me to stay hydrated during this treatment. So that's where we are in terms of the treatment. My next couple of days is going to be like this. So from day 4 till day 7, I don't need to go to hospital. I just carry on treatment like this. And then on day 8, I need to go to hospital to have my infusion for bleomycin and vincristine. So yeah, I'll keep you up to date how everything's going. The last couple of days, it's been better than the first few days for sure. Alright, I'm currently day 7 of my BEACOPDac. I'm going to group day 6 and 7 together again, mainly because it's been quite similar. And this video might be a bit longer, so I'm sorry. But essentially, how I'm feeling, I think I'm feeling the same as the last couple of days. The nausea and vomiting is not too bad. The nausea, I've got about a background amount of nausea there. However, it doesn't really make a difference when I take any anti-sickness medication. So I've not really been taking any anti-sickness medication and it's copable. The main thing that's affecting me at the moment is this altered taste that I'm getting in my mouth. That taste is there all the time and I mentioned it yesterday as well. This taste, it's just awful. Like, water does not taste like water and it just affects what I'm eating, generally speaking. So I wish that taste wasn't there, but it's there. There's not really much I can do about it. So I just gotta move on with it, I guess. Physically, I think energy-wise, it's lower than what it was before I started chemo, but I think I'm doing okay at this point. I think I'm doing not bad, so I can't really complain. I've just been on a walk at the moment. I walk from my home to my local university where I studied my undergraduate, my pharmacy degree, and it's just nice getting out of the house and getting some fresh air. The next thing is the steroids that I've been taking. I think I'm feeling the effects of the steroids. My sleep is very disturbed. I'm awake most of the time and I just feel that I'm a bit more snappy than normal when it comes to mood, and my mood can be a bit lower and I can be a bit more direct with people. So even when I was speaking to my nurse, normally I think about, trying to be as polite as possible and things, and I still am very polite, but sometimes I can accidentally say things which they might take disrespectfully, but the intention has never been disrespectful. So that's where I am in terms of the steroids. So medically, overall, I think I'm doing well. So one thing I haven't really talked about in terms of the cancer is how this affects your mood and finances and just work in general. So I thought I'll just touch on that as well. So first things first, I'm off work at the moment. I'm on sick leave. I get 2 months, then they're going to reassess after 2 months whether I'm fit to come back to work or not, which I don't think I will be. Obviously working in a hospital as a doctor, the risk of me getting infections is just way too high. We'll see what the hospital suggests, but the only issue with that is once my 2 months is over, any further sick leave I take would be unpaid. So things like, paying all the bills and things like that is going to be a struggle because I won't have an income and there's going to be a lot going on in the background. So that's one of the things that's on my mind. The other thing is mood. Obviously, since being diagnosed with cancer, my mood has been quite low and there's a lot of uncertainty about the future. Will this cancer be cured? Will there be any relapses in the future? How I spend my children's childhood with them? How will this affect everyday life afterwards? There's a lot of uncertainties. There's a lot of things I wanted to do in life. There's a lot of goals that I have, and not only for myself, but for my parents, my wife, my family, and I have to at some point sit down and figure out what's realistic and what's not, given my situation, given my finances, etc. So yeah, there's a lot of uncertainty on that side of things. And touching on mental health, one final rant I wanted to have is in regards to the help that you get from hospital. So the medical team, i.e. the doctors, the nurses that actually administer the chemotherapy, etc., they've been awesome. I have no issue with them at all. Where I do have an issue is these cancer specialist nurses. So when you get diagnosed with cancer, you get allocated a cancer specialist nurse. So this is a nurse that's a specialist in cancer, and they know all the services and things available, and they try and help you as much as they can. One of the things that they tell you is that, you know, you're not alone in this journey, they're there to help you, etc. But my experience has been very different, and I'm sorry this may offend a lot of people, but I'm just telling you what my experience has been with my specific cancer specialist nurse. So my cancer specialist nurse, first time I met her was when I seen my consultant hematologist for the first time. She was there in the appointment, she listened to the whole consultation, fine, no issues with that. Obviously you need to get to know me in order to know how to help me. But then after that, you know, my nurse, she spent some time with me, just giving me leaflets. If you have a problem with mental health, contact this number. If you have a problem with finances, contact this number. If you have problems with medication, contact this number. If you have problems with side effects, contact this number. And basically a whole folder of leaflets. Now, there's no issue in that, right? Obviously, you need somewhere where there's all the information. But where the issue is when I go home, I contact these numbers, and then they say, okay, this is the wrong number, you need to contact this number. You contact that number, okay, no. You know, you need to speak to this number, and literally redirect you back to the first number that was given and things. And there's just a lot of back and forth. Then I expressed this to my nurse. Now, look, in all the numbers you've given me, this is what's happening. And she said, well, that's it. There's not really much you can do then. You know, she's not going to try from her side. I told her my mood is low because she asked me about it. Are you feeling suicidal? Yes, I am. You know, what did she do? She said, okay, fine, I'll refer you to a psychiatrist. Fine, refer me to a psychiatrist. It's been weeks. I've not heard back from a psychiatrist. And it's just everything very slow, and I don't feel as though the nurse is there to help me, because the nurse is not there. They're not there clinically. Anything I ask regarding medication, oh, I'm going to have to ask the doctor. Oh, I need a letter for this. I'm going to have to ask the doctor. What is the role of a cancer specialist nurse if you can't really help me? Like, you're just giving me numbers, leaflets and things like that. But that's just a rant from my side. It's not been a good experience, and the communication has been horrible. And yeah, this is just my own personal experience. I'm sure it's probably different for other people, and I hope it's different for other people, because this experience I've had is not what I expect. So yeah, that's how things are going. Tomorrow is day 8 of BEACOPDac. I have to go back to the hospital. Chemotherapy, bleomycin and vincristine is the medications that they're going to give tomorrow. And then it's just 1 week of steroids and then 1 week of break. So I'm looking forward to once this is all done and just have some rest. Anyways, see you tomorrow. Alright, day 8 and day 9 of my chemotherapy. So day 8 was yesterday. I had the bleomycin and the vincristine. The consultant did warn me before the bleomycin that it can cause a fever. I had the bleomycin, and then about 4 hours later I developed a fever. I did not have the energy at all, and that's why I didn't manage to record yesterday. But essentially I had a fever, 38 degrees, and I was shaking quite a lot, so it felt like just having the B symptoms I had before I started the chemotherapy. So I rang the hematology helpline. They told me I need to come into A&E and get checked out. So I came in, they started me on the sepsis protocol, so they've taken bloods, and yeah, they started me on antibiotics just in case it's an infection, because you can't just put it down to a medication. You have to treat it as sepsis. I've been admitted to hospital overnight. It's now day 9. I'm still in hospital right now. I've had bloods taken. The bloods show that I'm very neutropenic. My neutrophils are very, very low. My white cell counts are very, very low. This is to be expected with chemotherapy, because I was spiking a temperature as well. It's even more serious. So the risk here is one of the side effects that's quoted, neutropenic sepsis. So yeah, this is where I am. I'm still waiting to be reviewed by a doctor today to know what the plan is, whether I'm staying here, whether I'm going home. But yeah, this is my first hospital admission in the whole journey. I've not had to be admitted to hospital before this. So this is where I am, day 9 of my treatment. So I was seen by the doctor earlier today, and unfortunately my blood test results still show that my neutrophils are downtrending. So my neutrophils was 0.05, which is severely low. But at the same time, they couldn't find any source of infection. My chest, everything was clear. So the advice from the doctor is it's best if I stay for 1 more day. And hopefully they're giving me some injections, the GCSF injection that I normally have, and hopefully that will help produce some more white cell counts, and by tomorrow there should be an improvement. So I'm having to stay in hospital for one more day. I'm not too happy about it, but if it helps, it helps. You might be thinking I'm outside right now. Yeah, I've gone out for a walk because it's just really depressing in the hospital. I don't even know what time of the day it is there. I don't know whether it's morning, night time. And sometimes you just want a bit of fresh air. And mentally, it does have an effect on you. Just sitting there alone, other unwell patients around you. And yeah, I just thought I wanted to get out of that environment for a bit. Just sit outside and just gather some thoughts. So that's where I am at the moment. I'm coming back to the hospital now as we speak. Yeah, one more night. Currently day 8, so hopefully day 9 I'll be out of hospital, and hopefully things should improve from there. Alright, I'm on day 10 of treatment. I'm still in hospital, unfortunately. They've taken bloods in the morning, so we're just waiting to see if there's an improvement from yesterday. I'm still waiting for a doctor's review, and maybe today is the day I'm going to go home and spend the rest of my cycle at home. But yeah, it's been rough being in hospital 2 nights. It's just been like there's not much to do here, and there's just no place like home, like, you know, the coziness of your own bed and things like that. So yeah, I just can't wait to get home. So I'm waiting for the doctor's review. I feel absolutely fine. No fevers since I've been admitted, except when I first got admitted. So it's been more than 24 hours, no fevers. It's just the only reason the doctors kept me in was because my neutrophil count was 0.05 yesterday. So we'll see what it is today, and we'll see what the doctors say today. Hopefully it's home. Just an update. So I've been seen by the doctor. They said my blood counts are still very low, but one thing they haven't done so far is a chest x-ray, just to rule out an infection. So the plan was to have a chest x-ray done, and if that's clear, then I'm good to go home. So the chest x-ray is done, and thankfully it's clear. So yeah, I'm good to go home. I'm very happy, finally. The rest of my cycle hopefully should be at home now. Right, so it's day 12 of my treatment now. Yesterday was day 11. It's been nice to be back home, to be honest. And although my blood counts, my neutrophils are still very low, there's not really much I can do about it. I'm taking the GCSF injection, so hopefully that should be having its effect. But yeah, right now I'm on a walk in the park with my daughter, which I'm really enjoying. And yeah, in terms of side effects, I have to take antibiotics because I was on antibiotics in the hospital, and I have to continue those for 5 days now. So I'm still taking those antibiotics. I am experiencing some side effects from the chemo that I've had, so I'm having a bit of jaw pain, which happens with vincristine, which I took on day 8. And I think I'm getting an aspect of oral thrush as well. And the reason I say that is because swallowing food is causing a bit of discomfort. And I've been on IV antibiotics for whilst I was in hospital, and I'm on antibiotics now as well. So all of this, it disrupts the normal flora of bacteria in my mouth. So it gives these opportunistic infections such as fungal infections the chance to grow. So I've got medication, nystatin, for fungal infection. I've not started using it yet, but it's something that I'll consider if this discomfort continues. Like, I've not got a white coating on my tongue or anything yet, so no obvious signs of thrush, but I can feel it coming. So yeah, that's where we are. It's just nice to be home, and soon, so on day 14, that's when my medication break is going to start for 1 week, so I won't be taking any steroids or anything. So I'm really looking forward to that. So yeah, that's where we are. Alright, it's day 13 of BEACOPDac, and it's currently 2:30 a.m. in the morning, and I'm here in the car on the way to hospital. It's been a really long evening, so since last evening I just started randomly getting left-sided hip pain, and it felt quite deep, and I didn't know what it was at the time, but as the time went on, it went to both sides of the hip, and I just could not sleep. I could not lie down. It was just too painful. Like, I've never had this sort of pain before. It's probably 10 out of 10 pain. I've just been tossing and turning in bed, and I just couldn't cope with anything. So I had some paracetamol, and the paracetamol didn't help at all with the pain. So I rang the emergency helpline, and they said that likelihood is it might be because of the GCSF injections that I've been having, because I've had to have 3 extra days worth of the injection because of my recent hospital admission. So because of that together, the bone marrow is trying to produce a bit too much white cells, and that's a possibility. But the thing is, the pain is so unbearable. They told me just come in for an assessment. I'm probably going to need some strong painkillers, something like morphine or something. So I'm on the way to hospital right now, and let's see what they do. But it's not been a good start to the day so far. Alright, so just an update. I've been seen by the doctor, and the doctor said that most likely what I'm experiencing is from the GCSF injections stimulating my bone marrow to produce more white cell counts. They literally described it as labor, although obviously I don't know how that actually feels, but this pain, I've never had anything like it before. I'd probably rate it 10 out of 10. It's a really bad pain, and it's just constant. The only thing that relieves it is when they give me paracetamol through the veins in here. That's the only thing that seems to relieve it at the moment. Oromorph, morphine, all of that, it just does not touch it at all. So that's where I am. So although they think it's the GCSF that's causing it, they said they need to exclude other causes. And one of the other causes that they are thinking is steroid induced. So they think that because I'm on high dose steroids, there's a possibility that that can damage the head, the blood supply to the head of my hip bone, the socket. They want to do an MRI scan to basically rule that out, because that in itself is its own problem. So that's the situation we're at the moment. Right, so MRI results are back. There's no avascular necrosis, so no damage done by the steroids. So they've put it down to most likely the GCSF injections stimulating the bone marrow. And they said paracetamol is literally the best thing for it. There's not, like, they've given me morphine to take home, but they said that, yeah, it should just only be a few days, and just take that. They gave me some crutches as well to use if the pain gets really bad. They said ideally don't use it, but they've given it just in case anyway, and I am being discharged. I'm going home, so I'm very happy about that. So let's see how the day goes. Alright, I'm on day 15 of treatment, so this is meant to be my tablet-free week, and so far it's just been awful. I am exhausted, and you can see right now I'm in a hospital gown. I'm in hospital because since night time I've just been getting this diarrhea that just would not go. I probably went 20 to 25 times overnight, and there's a lot of blood in the diarrhea as well. So I rang the hematology line, and they told me that I need to come in. They need to test things further. So I've been in hospital, but I've not had the energy to eat or drink. Even making this video, like, I simply just do not have the energy, but I am so tired right now. And yeah, my tablet-free week is not going as I wanted to. Like, I'm getting really bad stomach pain. I'm getting this non-stop diarrhea. So let's see how this goes. It's now day 16. I'm still in hospital. My diarrhea has settled a bit, but I'm still getting really bad abdominal pain. They've done a CT scan, and the results of that I'm still waiting for. The doctors are going to come around at some point today and speak to me about it. But yeah, it's just been awful. I thought generally things were going well this cycle so far, but the last week or so, 3 admissions in the last week alone, it's been really bad, and it's just, I'm at the moment, like, I just don't know what to say. It's not going as well as I thought it would be going. I'm getting a lot of the side effects. The pain that I'm in at the moment is unbearable. I'm on lots of medication, and even my hair, I'm not sure if you can see all the hair on my pillow, but my hair is just falling out in clumps now. So eventually when I do get home, I think the first thing I'm going to do is have my hair cut, because it's making a mess everywhere I go, wherever I go, in the bathroom, in the room, on the pillow, my clothing, everything. It's just too much of a mess. And I just want more control of my life at the moment. It just seems as though when one thing resolves, another thing starts. But I was warned of this, the BEACOPDac. It's a very intensive treatment, and it's not for everyone, this treatment. So that's where I am at the moment. I'm still on my pill-free break, meaning I don't need to take any steroids or anything this week, which is good. But I'm very close to when my second cycle starts. So yeah, I guess it's just a case of waiting to see what happens. Right, CT scan done. I've spoken to the consultant who was doing the ward round, and he said that I need to stay in for the weekend because most likely it's a infection-related colitis that I'm getting. So I have to stay on antibiotics. Even though the cultures and everything has been clear, the fact that I'm responding to it and just showing even slight improvement, he said that it's probably not the chemo. It's probably I've got some sort of infection from the food or something. So I guess I'm going to be here for another couple of days. It's not how I expected things to be, but it is what it is. I'm just really tired. And yeah, it's just frustrating. Just being on your own, and it can have a big effect on your mood. But yeah, this treatment, BEACOPDac, it's very intense so far. Okay, day 18 of treatment. Still here. I've got more hair loss. You can see that my hair's pretty much is gone on a downfall now. But my diarrhea symptoms, everything, it's improved. The bloods, the doctor said, is heading in the right direction, but he still wants me on antibiotics for a couple of days, so I still will be in hospital for another 2 days. And then hopefully if my bloods are okay, then cycle number 2 starts on Wednesday, which is a couple of days after I finish the antibiotics. First thing when I get home, I just want to chop off my hair because it's making a mess everywhere. There's hair everywhere. Alright, it's day 19. I'm still in hospital right now, but I've been reviewed by the doctor. I'm feeling so much better now. I feel almost back to normal. My bloods are moving in the right direction. I've had the IV antibiotics. I'm still having it currently, but I've been reviewed by the doctor and he said that I can go home, finish my course of antibiotics as a tablet at home, and I need to have my bloods not tomorrow, but the day after, and then on the actual day of the chemo, or the first day of the second cycle, the doctor will decide whether to go ahead with the chemo cycle or not. So that's the plan. So yeah, it's I'm very happy to be going home because I've been here for, I think it's been three or 4 days now. It's been here and it's quite lonely here. I get visitors, family have come, my wife comes every day, but there's just something about being at home which is really good, and yeah, I'm just happy to be going home. So yeah, hopefully, fingers crossed, bloods are all okay at the end of this cycle. Hopefully when I go home, no more hospital admissions. So yeah, let's see how it goes. Let's see what tomorrow brings. Day 20 of treatment, and as soon as I got home yesterday from the hospital, the first thing that I did was I went to the barber's, got a full haircut, because 80-90% of my hair was gone pretty much already, and it was just falling out in chunks. So that's the first thing that I did, had a shower, got ready, and now I feel much more fresh. Don't know how I feel about this look, but it was inevitable anyway. The night was okay, I managed to sleep. However, in the morning I started getting the same pains in my abdomen that I was getting when I had this whole bout of diarrhea, and I had to go to the toilet twice, diarrhea-like stools, but thankfully after that it resolved, the pain resolved, and it didn't continue. I was scared that maybe I'm getting that flare up again and this is going to continue, and thankfully for now it's gone okay. So just a summary, this is my second last day of the cycle. Tomorrow I'm gonna get my bloods done, and then the day after the doctor will make the decision, depending on the bloods, whether to go ahead with the second cycle of the chemo or whether to delay it until the bloods are looking better. So that's where we are at the moment. Again, glad to be home, and yeah, just catching up on emails, letters that I've received in the post, and just admin things that I need to do. Alright, it's day 21 today of my first cycle, so this is the very last day of the first cycle. The weather looks really good out here, but trust me, it's 0 degrees, so I'm all wrapped up. I got hat and scarf on. I'm feeling good. Yesterday I had a bit of a scare because I had a bit of diarrhea and abdominal pains yesterday. However, it resolved itself more or less, so I didn't have any blood or anything, so I didn't really need to go to the hospital. I got advice from them anyway, and they said, yeah, I don't need to come in, which is all good. But today I'm feeling completely fine. I feel I've not really had that much time to recover, but I feel well enough that, you know, if the next cycle was to start tomorrow, then fair enough. So that's how I feel at the moment. I'm on the way to get my bloods taken in the hospital, and depending on the blood test results today, the consultant will make a decision tomorrow whether to start the second cycle or whether to delay it. So that's how things are going. Before I start the second cycle, I do want to make a separate video just talking about my overall thoughts throughout the first cycle, and things I wish I knew. So yeah, this is my final day of the cycle. It's been up and down this cycle.